welcome to the clinic. My name is Dr. Abby. We can go on a first name basis here. I'm one of the many doctors here at the clinic. Yeah, I've been here for about 25 years, so you're in good hands. And I understand you're a new patient with us, is that correct? Okay, all right, let's go ahead and take a seat. Let's get some information from you. Can I start by getting your full name? Great. And your date of birth? Lovely. Okay. So what brings you in today? Okay, so you just moved to the area. That's exciting. Just getting registered with a new clinic. Got it. Okay. Any health concerns? Anything you'd like to talk about today? Okay, some feelings of anxiety. Okay, sure. Do you mind if we start with just some general health questions and then we can chat a little bit more about that? Okay, great. I just want to get to know you, log you in the system a little bit. So, if you don't mind sharing what you do for work, what does your typical day look like? Okay, and do you enjoy it? You do. Good. Do you work in an office or do you stay home? Work from home. Okay. How have your stress levels been lately? Okay. Are you getting enough sleep? How would you describe your sleep quality, your full 7 to 8 hours? Okay. Sometimes you struggle to fall asleep. Okay. Sometimes anxious at night. Okay. And with regards to your anxiety, would you say it's more mental, or does it show itself through physical symptoms or a combination? Okay. Yes. No, of course. Sometimes strong physical symptoms of anxiety can be quite similar to health conditions, like if there was something physically wrong, so it's good that you're coming in to get checked out, but from the sounds of it, it's just anxiety. There's nothing wrong with you, but we can work towards finding some coping mechanisms that work well for you. But anyway, today we'll give you a full check just to make sure you're okay. Have you had any major illnesses, surgeries, any ongoing health conditions I should be aware of? Okay. You had your tonsils removed. Okay, when was that? When you were 5. Okay. Alright. Do you have any allergies to certain foods, medications, environments? Okay. Dust mites. Oof. It's a tough one. Yeah, they make like bed covers sometimes that you can put on your mattress that help with dust mite allergy, but yeah, they're everywhere in the home. So if it gets bad, we can talk about exposure plans, but that's something, yeah, we can discuss another time. Okay. Are you currently taking any medications or supplements? Okay. And for how long have you been on those? Yeah. And are they working well for you? Okay, great. So, does anyone in your family have any history of health diseases, diabetes, high blood pressure, heart disease, any autoimmune conditions? Okay. And that's on your mother's side. Okay. Your grandfather. How often do you exercise or try to move your body throughout the week? Of course, yeah, light yoga counts, stretching, going for walks. Okay. Do you go to the gym? Nice. And that works well for you? Okay, great. Are you comfortable with your weight? You look quite fit, so. And do you know your height by any chance? Okay. How would you describe your diet? Is there anything you'd like to improve or work on with your diet? Okay. Do you follow any specific diet plans, like keto or vegetarian? Okay. And do you have any reason to believe that you may have kind of hormonal imbalances? Do you find that you tend to have mood swings, or you're in quite an irritable mood sometimes? Sometimes, with the time of the month, that can increase or elevate feelings of anxiety, but it's good to be aware of. How are your energy levels typically throughout the day? Okay. And how have you been feeling emotionally overall? Good. Good. Okay. And how often would you say you experience feelings of anxiety? And with regards to the physical symptoms you mentioned, what does that look like for you? Okay, so some chest tightness. Can you show me where exactly? Okay, right in the center. Does it impact your ability to go about your day? Okay. Do you find you have any other symptoms with that? Shortness of breath, dizziness, any pain in the jaw or down the back, down the arms? No, okay. And what do you find typically helps when you feel those symptoms? Any coping methods? Yeah, fresh air. Have you tried breathing techniques, breathing exercises, meditations? Yeah, okay, good. I'd really recommend those. And do you have any trouble with your appetite when you're anxious? Okay. Okay, and do you feel like you have good support from friends and family and people around you? Someone to talk to? Okay. Do you live alone? Have you considered talking to someone like a therapist or a counselor just to discuss how you've been feeling? Okay. Well, you have a new therapist lined up. Wonderful. That's good. You can mention to them how you've been feeling and chat about plans for managing those feelings when they come on. Of course, you can always come and talk to me, but just in case you'd like to chat deeper with someone. Okay. Is there anything else you'd like to chat about before we get started with your check? No? Okay. Then go ahead and relax. And we'll get started. Just going to put some gloves on. And may I touch around on your face and on your body today? Okay. So sorry for the yard work sounds outside. It's been going on all day. Yeah, I suppose they're preparing the landscaping for the winter time. Okay, so just taking a quick look at you. Noting any visual abnormalities. Would you say you're feeling quite well today? Okay. Did you get enough sleep last night? Okay, I'm just gonna touch around on your face. You're not feeling sick or ill in any way? Okay, good. So I'll check all of your vitals today. Yeah, I know sometimes if you're feeling particularly anxious, you can start to worry about something being physically wrong health-wise, but no. We'll make sure that you're well and healthy. So I'm going to start by listening to your chest, okay? Might be a little bit cold. Okay, so just exposing the top of your chest here. And just placing this right there. And if you could just breathe normally for me. Just taking a listen. And here. And right here. And down here. Down here. And up here. Okay. Now just take a deep breath in for me. And let it out. Good. And another deep breath in for me. And let it out. Good. And another deep breath in for me. And let it out. And one more deep breath in for me. Good. And let it out. Okay. Perfect. Everything sounds completely normal and healthy there. I prefer this to go. no cause for concern with your chest. So, next, I just want to feel for your pulse, okay? If I could just take this wrist. Okay, I'm just feeling for a moment. Good resting heart rates. Okay, so we're going to check your blood pressure next. I'm just going to use this device, and do you have an arm preference? Sure, okay, we'll do this one again. So this is just going to go up around your forearm here. If I could just roll up your sleeve here. Okay. Yes, sometimes when you are nervous, your blood pressure can be elevated. It would be a good idea if you'd like to check at home. You can get one of these cuffs just online. You can buy one and start checking regularly just to make sure that you're okay. Sometimes when you go to the doctor's office, your blood pressure can show high at first because you might be nervous. So I like to check at least twice if it is high at first. Just give you the chance to relax a little bit. Okay. Is that comfortable? Okay, just let me know if it's not and I'll take it off. So we're gonna turn it on now, okay? And you'll feel some pressure. It's gonna be okay. It's actually 118/78, so that is perfectly healthy and normal. Just slide that off of your arm. Okay, excellent. See, nothing to be worried about. Okay. So, got your vitals checked. Now, I'm just going to take a closer look at your eyes, your ears, and your throat, okay? Have you been to the eye doctor recently? No? Do you have any trouble with your vision? Can you see me clearly? Okay, can you tell me what color my shirt is? What color are my gloves? Good. What color is this light back there? Okay. This yard work is driving me crazy. I'm so sorry. Okay, if you just look straight at my nose, bright light coming in. Just gonna take a look at your eyes. Yeah, just don't look directly at the light. Okay, keep looking here. Your eyes look good. No signs of irritation, redness, swelling. Okay, I'm just going to pull around on your eyelids. Just pulling down here, and can you look up? Just look up for me. Good. Same thing in the other eye. Look up. Healthy and fine. Good color. Okay, can you look down now? Just look down. Just look down. Good. And look down again. Great. And can you look over here? Excellent. Can you look right here? Try to keep your head still. Okay, let's do this side. Just follow my finger. Any double vision, blurriness. Okay, you're tracking well, so that's good. Okay, just look at my nose. Can you tell me when the light comes into your vision? Mm-hmm. Mm-hmm. Good. 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 Okay, let's do a quick wiggle test. Can you just point to whichever side is wiggling? Good. 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 Both. Good. Good. Excellent. Alright, so I'm just going to feel around your eyes. You can close them if you'd like. Do you struggle with migraines, headaches? Any pain like in the back of your eyes? Okay. Okay, do you experience any like white spots, floaters in your vision at all? Good. Alright. Just one more test. If you can just look at my finger and then just follow it into your nose. Back out. Okay, one more time. Follow it in to your nose and back out. Alright, perfect. So, I seem fine. Now I want to have a quick look at your head, through your hair a little bit, your scalp. If you could just tilt your head down for me. Just take a look. Feeling for any lumps, bumps in the back of the head. The back of the head. Behind the ears. You haven't had any accidents, any bumps to the head recently? Okay. And as well, just taking a look at the scalp, checking the hair, making sure everything looks healthy. There's no points of pain if I just press on your head like this. No pressure. Okay. Check the hairline, the forehead. Just moving down, feeling the jaw. Okay, I'll check your jaw in a minute. I'm just going to take a closer look at your scalp with my light. So just look down again so I can see the top of your head. Okay, thank you. Just take a look here. Separate the hair, take a look. Okay, just turn for me this side. Just checking around the ear. Okay, just turn for me the other side. And then look all the way down, chin to chest. Checking the top of your head. and look up. Okay. I'm just having a look while I'm here with the light on your skin. You don't have any skin concerns like acne, any rashes, any irritation? Okay. Good. Alright. Just feeling your glands. Like right under the ears. Glands don't feel swollen. Can you open up your mouth? And close. And open. Close. And open one more time. And close. Okay, no clicking. Alright, if you open up again, I'm just going to take a look at the back of your throat. I'm going to press your tongue down with this stick. Just say ah. Ah. Good. Okay, no nasal drip, no irritation. Lumps at the back of the throat. Looks healthy. Okay, can you lift your tongue up? And put it to the side. And the other side. Okay, put your tongue down. Now I'm just checking the size of your mouth. For any signs of infection, mouth sores. Good there. Do you have a local dentist since you moved to the area? Okay, next on your list. I do notice it looks like you have a bottom wisdom tooth erupting. Has it been going on for a while? Okay, if it causes you any pain, you can check with your dentist, but everything looks good there. Alright, I'm gonna feel your face and check for sinus pressure. And right here, the middle of the forehead. Any numbness or tingling in the face? Okay, can you close your eyes and just tell me where I'm touching you? Just a quick sensation test. Good. Okay. Good, okay. Let me jot some of these notes down. Glands feel good. Solid lymph nodes. Face. Can you raise your eyebrows for me? Okay, just gonna attempt to push them down. Good, okay. Can you close your eyes really tight? Don't let me open them. Okay, and puff your cheeks out and don't let me push. Alright, now try to lean into my hand. Don't let me push. And here, don't let me push. And from the bottom. And from the top. Okay, very good. Yeah, this turned into a cranial nerve exam. It's fine, I have time. Just want to make sure that you're okay. Alright. So, I'm going to feel down your neck. I'm just placing my hand here on your throat. Can you swallow? Good. Okay. Feeling the shoulders. Any stiffness, tightness, apart from the usual computer strain, Feels okay. If you just relax your body, I'm going to try to rock you back and forth. Just like that. Any pain? Okay. Good. And if you relax your head, just let me move it around slightly. Any pain in the neck, at the back of the head? Okay, good. Just hold it like that. Okay. I'm going to feel down your arms. Just let me know if there's any pain. Just squeezing. Taking your hand, just gonna pinch your fingers. Roll your wrist. Any pain? Okay. And if you just hold your arm up like that. Okay, then put it down now towards me. Bend at the elbow. All feels okay? Alright, so you can put that down. Okay, this arm. Wrist feels okay. Alright. Just put your arm up. Any pain? Okay, put it down and out towards me. Bend at the elbow. Good. Okay, you can relax. I didn't look in your ears, so we're gonna backtrack and do that. This right here. You just turn any way you'd like. This side first. Okay. Just going to take a closer look inside this. Clear there. Pardon my chair. Okay, and just turn the other way. Good. Just coming in on this side. Pretty good. Good. Okay. And I assume you've been able to hear me clearly this whole time. That would be awkward if not. Okay. Any pain or ringing in your ears that you've noticed? It's gonna feel just pulling the earlobes slightly. Okay, just close your eyes for a moment. Quick hearing test. Tell me on which side you hear my gloves. Okay. Good. Good. Great. Okay. peek up your nose. Okay. Alright, just tilt your head back. I'm gonna take a look here up your nose. Take a look up your nose. Look at the nostril. The other side. Okay. Good. Alright. And just hold one side, and if you could breathe in, and the other side, breathe in. Okay, good. Okay. So I'm just going to finally just tap around, percuss a little bit on your chest and on your abdomen. Okay. Okay. Just feeling. Do you have any chest pain right now? No? Okay. Good. Alright, just feeling around your tummy. Any pain on this side? Okay. And this side. Good. Digestion is okay? Yeah. Okay. Good. Just taking your hands on some more. Look at the fingernails. Okay. Alright, my friends. Well, you are totally normal and healthy. You are doing a great job taking care of yourself, so I wouldn't worry at all. Okay, you're doing a great job. So just making note. Feel free to, of course, come on back if you have an infection, the flu, or if you are concerned about any chest tightness or anything like that. Yeah, always happy to chat, of course. Alright. Yeah, if your feelings of anxiety don't tend to get better as you progress with your therapist or start doing more regular meditations, we can discuss medication options, but let's try a holistic approach first, okay? Do you keep an anxiety log or a journal or anything? Yeah, what you can do is just when you're anxious, you can write down what's been going on, and that might help you to identify patterns and establish what causes those feelings to come on. Might help you better understand how to manage it going forward. But I'm really glad that you came to see me anyway, so that I could meet you. Alright, do you have any other questions? It was my pleasure, of course. So again, it was really nice to meet you. Yeah, I'll be here. Again, my name is Dr. Abby, so you can come back anytime. Okay, well, I will save your file, and again, no need to worry. You are very healthy and fit. Okay, great. Well, you have a great rest of your day. Of course, I'll see you next time. Thanks.